Hi everyone, my name is Olivia Mariano, or Liv for short, and I'm a speech-language pathologist at the Down Syndrome Resource Foundation in Burnaby, BC. Today we're going to be talking about dual diagnosis, specifically Down syndrome and autism spectrum disorder, or ASD for short. Did you know that it's estimated 5 to 20% of people with Down syndrome have autism too? The diagnostic criteria for ASD are related to difficulties or impairments in social skills and communication. Therefore, we as SLPs have experience in treating individuals with ASD and often provide insights on the signs and symptoms consistent with an ASD diagnosis. We often get asked questions from parents, teachers, and other supporters about what things are consistent with Down syndrome and what things are consistent with autism. And as you'll learn today, there is some overlap. The purpose of our video is to better understand what ASD looks like in individuals with Down syndrome so we can better understand our students with dual diagnosis and ultimately support them. My hope is that this video will answer some of those questions, give you some idea of what signs to look for, and strategies to help them learn. So let's take a closer look. First, let's take a look at some of the strengths of individuals with Down syndrome. Compared to peers with ASD, individuals with Down syndrome have a relative strength with eye contact. This means that they show interest in looking at your face, often check in to see, what do you think about that? They show you an object by looking at it, pointing to it, and then looking back at you. This is something we call joint or shared attention, and it's a foundational skill for learning. We must have the ability to look, attend, and share things with others in order to learn about them. Another relative strength is their use of gestures or signs to supplement their expressive language. They may show you things, point to things around the room, give a thumbs up or a wave. They also attempt to imitate your actions and take turns with you. You may say something and they'll respond back, going back and forth. Their communication development also follows a typical sequence, much like we see in normal speech and language development, just at a slower rate, going from sounds to words to 2 words, 3 words, and so forth. Some other things we see in individuals with Down syndrome is often an adherence to routine. They prefer sameness and predictability. We also know that 50 to 80% have hearing loss and auditory processing issues, so they might not always be responsive to their name or when you give them directions. In general, we know that eye contact is often less than a peer who is typically developing, and there's some sensory needs because they process sensory information differently than other children, which might result in them being sensitive to certain stimulation or seek out sensory input, like putting their hands in their mouth. They might also have restricted interests, like being really interested in certain TV shows, and due to slower development, you might see them engage in repetitive play and behavior. Another thing we may commonly experience is a range of sleep-related difficulties or mental health illnesses, like anxiety. So let's take a look at ASD more closely. Individuals with autism might show more interest in objects than in people, so we often get less of that joint attention, that back and forth eye contact, and less gesture use, like pointing or showing others things to initiate communication. Instead, you might see them grabbing your hand to use it as a tool to push or open something. They may also lack verbal communication, and this is often paired with little attempts at using other modes like signs, gestures, or eye gaze to intently communicate. I've mentioned a few examples, but if we look at the big picture, we see that there's a lot of overlap between Down syndrome and autism learning profiles that makes sometimes detecting it difficult, even for professionals. So to make things more clear, I want to introduce you to Jackie and Sam. Jackie is a 4-year-old child who loves cars, music, and toast. Sam is also 4 years old. He loves cars, music, and what do you know, toast too. Jackie and Sam both have Down syndrome. Sam also has autism. Sam and Jackie are similar in a lot of ways, but are a little different in others too. Jackie is playing alone with cars. He loves to drive them, pretend to wash them, crash them, reenacting things that he's seen in real life. Then his mom walks in the room. When his mom says, "Hi, Jackie," Jackie looks up and smiles. He acknowledges her with eye contact and responding to her. When Sam's mom walks in and says, "Hi, Sam," he continues to look at his cars. They are so cool to look at. He sits and spins the wheels over and over. He enjoys the way they look. He also enjoys when his mom's around, so he smiles to himself and hums, but continues to look at the toy. When she sits down to play next to him, wanting him to drive the cars, he turns his body away. He prefers to play with things in a more cause and effect way. Some people call this non-symbolic or non-functional play, like lining up toys, spinning them, or opening and closing them repeatedly. Jackie wants his mom to join in and play, so he shows his mom what he's playing with by lifting it up so she can see. His mom says, "Car!" Even though he can't say car yet, he tries. He attempts to imitate others when he can. When his mom joins in and plays with him, he frequently looks at her to check in to see how she's feeling about all this. He does a great job shifting his attention to his toys, back to his mom when they're playing. Sam's mom labels what he's playing with, car. Sam doesn't attempt to imitate her words. He used to be able to say car, but recently his mom has noticed he stopped doing that. Jackie drives his car back and forth and pretends to park it. What would make this more exciting? Oh, a ramp, of course. Jackie doesn't have a play ramp, but that's okay. He sees a book he can use as a ramp. Jackie frequently uses objects to represent other things, like using a shoe for a phone. This is called symbolic play. Jackie also sees a bright red fire truck on the shelf that he'd like to play with. But oh no, it's out of reach. And he has a really hard time saying fire truck. But that's okay. Jackie points, looks at the fire truck, and then at his mom to communicate, "I want that," and his mom gets it down for him. Sam really wants to play with the fire truck out of reach. He starts to scream. His mom wonders why. Is he hurt? Does he need something? Sam continues to sit and cry and starts to rock back and forth rapidly to calm his body down. His mom is still confused with what he wants. This is because Sam has trouble with verbal communication and hasn't quite learned how to use nonverbal communication modes like gestures, facial expressions, or signs to communicate yet. Jackie, like Sam, has delays in expressive language, but he often uses symbolic gestures and signs to support expressive language, like reaching, pointing, waving, blowing kisses to support his expressive language. Sam's mom knows him best, of course, and remembers that he loves the fire truck. That should make him feel better, so she offers it to him. He focuses on the fire truck as she passes it to him. His favorite part is pushing the button to make the alarm go. He does it over and over and over. He seldom looks up at her to see her reaction. It just looks so cool. Both children have slower than normal development in their speech, expressive communication, understanding, and they might also have other things in common, like hearing loss, challenging behaviors, and sensory issues. And while it's true children with Down syndrome have difficulties in social communication compared with their typically developing peers, when you look at their overall communication profile, we often see that they have relative strengths in social communication and play skills compared to children who are on the autism spectrum. There are also some other clinical signs we may observe that would warrant a referral. A clinical sign we often observe are higher levels of sensory challenge, whether that be sensory seeking or sensory sensitive. This could also pertain to feeding. They could have difficulty accepting new foods or have reduced preferences in a variety of foods, like eating only one food group, texture, brand, color, or temperature. You might also see other behaviors like throwing certain objects, repetitive body movements like rocking back and forth, flapping, and the need to move their body in order to regulate. There are also higher levels of sleep troubles. In addition to sleep apnea we often see in Down syndrome, they could have other things like delayed sleep onset, restlessness, night wakenings, or early awakenings. In some individuals with autism and Down syndrome, we see a pattern of very high speech skills, like saying their favorite dinosaur, Diplodocus, super clearly, with very few speech errors, but this isn't accompanied with equal language, social, or play skills. Another red flag of autism being present is regression. Sometimes we observe a loss of skills. Like we saw earlier with Sam, individuals with autism can go through a period of regression in cognitive, language, or social abilities. In higher instances of behavioral issues, and often they're more extreme and severe, like self-injurious behaviors or meltdowns. Isolated items from this video can be behaviors that are relatively common for children with Down syndrome. However, the more behaviors we see from the list, the more referral may be warranted. If you suspect your child may have autism, the first step is to consult with one or more members of your professional support team, such as your pediatrician, speech therapist, or child psychologist. If they share your concerns, they can provide you with a referral for a formal assessment. So let's talk about diagnosis. Diagnosis in individuals with Down syndrome is often late. One study found that the mean age of autism diagnosis was 14 years, despite the fact that many of these symptoms are often present in early childhood and affect daily functioning. So why get a diagnosis? An accurate diagnosis is important to get access to more funding and services for things like behavior consultants and therapists. An increased understanding of your child and an understanding of their unique profile and learning needs. Even though many of the strategies are similar, there are different strategies that we know work better for individuals with autism specifically, a few of which I'll go over shortly. And also for medical follow-up. Having a diagnosis of autism could inform our medical decisions and the need to follow up or rule out other things that could be creating learning challenges for our child. So why do people not want to seek out a diagnosis? Despite the increase of support, many parents experience grief when they find out their child has Down syndrome because often it's not the journey they had originally pictured for their child, so it brings back those feelings of grief. This could also feel like another label for their child. Often our parents say they feel confident with finally understanding Down syndrome, and now this is something else. Another long series of assessments or fear of being isolated by others, which is the last thing they want. So what are some of the strategies that help our students with autism? Many of the strategies we utilize work well with students with Down syndrome, but are particularly helpful for students with Down syndrome and autism. As always, when we think of strategies that we're going to utilize, we're going to highlight the strengths of these students. The first is schedule and routine. Routine can actually be a very powerful tool in helping students deal with the uncertainty that's inevitable in their day. Like we mentioned, individuals with autism and Down syndrome like routine and sameness, which can bring them comfort and keep them well regulated. It can also be a great way for us to build in flexibility, taking them through changes they'll come to understand ahead of time, that things can be the same but different, and that's okay. The second is work systems. This means prior to a task, giving them clear, visual expectations of what they're going to do, how many they need to do, when they will be done, and what is next. This helps with independence, compliance because they know exactly what they need to do, which reduces anxiety and allows for the student to experience accomplishment, which can be especially important in academics and teaching other new skills. The third and one of the most important strategies is visuals. They're extremely important for a number of reasons. First, we know that individuals with Down syndrome and autism have strengths in their visual processing as opposed to their auditory processing. So visual supports work really well as a way to communicate things. It helps their understanding when visuals are accompanied with words or directions, and to help support difficulties in the areas of speech and expressive language, because it helps them better communicate with others if they have an alternative way to do so. Visuals can be objects, photos, drawings, words, including sign language. In order to learn and thrive, here are some important building blocks of your team. At the foundation is health. Healthcare providers make sure your child's well-being is taken care of, and we are at the absolute healthiest we can possibly be. We want to rule out or manage any health issues that may be affecting your child's ability to learn. This is done in conjunction with an interdisciplinary team of professionals, like a speech-language pathologist, occupational therapist, board-certified behavior analysts, or BCBA, or behavior interventionists, or BI, all of who can help you achieve your goals, whether they be in academics, employment, or leisure. Thank you for taking the time today to learn more about autism and Down syndrome. This video is brought to you by the Down Syndrome Resource Foundation. For more information and resources, visit our website at dsrf.org/information/autism.